we can start with the conclusions. And Joyce?
Yes, thank you. I was the moderator of the oral hygiene in practice workshop, and we talked about a lot of things, starting with toothpaste. Simple is better, like Sensodyne and Biotene, mouthwash without alcohol, and fluoride in toothpaste and rinses. Very important. Use humidifiers. Keep the mouth moist. Small sips of water. Massage the glands and use some chewing gum. Avoid alcohol, sodas, and smoking. How to avoid cavities. Use softer brush. So the softer, the better. Electronic brushes, perfect. Avoid sugary foods. Use interdental brushes and floss, very good. And visit the dentist every 3 or 4 months. It's a very high priority that we really see the dentist regularly. And that was a lot we talked about. The last question was, I think, having a prosthesis or implants, and implants are better.
Thank you.
Thank you very much.
Thank you, Joyce. I was moderating the workshop called Designing Better Clinical Trials. It was a very, very specific workshop because we had the honor to have Lucio with us. Lucio, if you please, thank you. And Lucio has described his perspective of being involved as a patient, as a male patient. Gavin, it will talk to you. Into a clinical trial. So it was super, super interesting, inspiring, especially because Lucio was really recently diagnosed with his Sjogren's disease. So it was really, and thanks again, Lucio, for your open story, for opening your story to us. The second part of the workshop was a discussion. We had the chance to have Professor Goules, Professor Baldini, and Professor Devauchel with us, and a couple of patients and pharma partners in the room. So we have been able to have a really nice and simple discussion about how patients are feeling in front of a clinical trial. And what was super inspiring is to listen very honestly the clinician perspective. And all the patients in the room were, let's say, really impressed by the dedication of our clinician. They are not here, I can tell him. I can tell you that I was really, really impressed by the word they share with us. And I think of Professor Goules, because he told us 10,000 times during that workshop that safety first. If a patient is not well in a clinical trial, he stops the clinical trial without needed a valid reason. Every reason is valid for him. The patient feels unwell, we stop, and you are still my patient. We also always got back to communication. And again, Professor Goules, Professor Devauchel, Professor Baldini really insisted on the fact that they have special bonds with their patient. And the patient in the room, if we ask them, what could convince you to participate in a trial? And they all have said, the bond I have with my physician. the communication I have with the physician, or the relationship. And really, if we could have just one conclusion to this workshop is, if you want to design a better clinical trial, put everything on communication and relationship. As soon as a patient will trust his physician, he will go everywhere. And Professor Goules always talk about safety first, no industry, and he said sorry to the industry partner in the room. He said, and I will quote him, we as a physician, we have the control. We don't care if the clinical trial end up. We stop the trial if the patient is not well. So always putting the patient first. And regarding the design itself of the clinical trial, the three clinicians in the room who are doing, as you know, a lot of research in Europe, said that really things have really changed these years with designing trials with tools, including the patient's symptoms burden. Professor de Vauchel emphasized also some trials to stop or block the disease progression, and they all have the disease damage in mind. So again, patient-centered medicine. And I guess that's it. We did have a couple of very interesting testimonies from patients who was entered a clinical trial, and I guess that's it. But again, really artful testimonies, and really, I don't know, I think I share with the patient in the side, really inspiring to see these clinicians only focused on patient burden, patient quality of life, and research. So thanks to them as well. Thank you.
So the third workshop was about self-management and tools that work, and we have a very good discussion with our three speakers, who was Mrs. Giannulli, which is the certified mindfulness teacher, Mrs. Celeste Siazon, which is the global director of communication of Novartis, representing pharma industry, and André Fauquin, which is the president of Agora Federation and the Cyprus League of People with Rheumatism, who represent the patients. We have a very good discussions, and that we can, the results of that discussion was, and the questions asked, and the answers received was that, first of all, mindfulness is one of the most important, it belongs in one of the most important tools that we can integrate our self-management. Self-management for the patients means that we have to know and help the patients to be prepared when they will come and we go to our doctors to write, to think, to write, and to be ready to ask questions and not wait to go to the doctor and think what we're going to ask him. And this is self-management. Self-management means that we can have and we can accept our illness as a friend, and we can cope with him. We can be friend with him in order not to feel stressed and disappointed. And the self-management also means that we have to communicate and not to feel guilty. We don't have to socialize them. And the main question was how I need that tools and that things and that awareness can do. That we said that we have associations, patients associations and federations have a very great role to play on the training of patients in self-management, and of course that we want tools that will be a long time tools, not short time tools. And the main point is that we must have trust between stakeholders, clinicians, pharmacy, and patients. We are collaborators, we are partners. We don't be one, two, three. We're friends, we're families. So this is the results of our workshop. Now, before going, please come here to have the family photos.